Sawubona mlaleli we-Skills Village Radio.
My name is Princess Sibanda, also known as
The Promised Princess.
Nkabikazi on a moving throne. Do tune in on the Health and Awareness Show, where we discuss and promote health education and awareness within the disability community.
We have the whole day.
Every Tuesday between 10 a.m. and 12 p.m., exclusively on Skills Village Radio. Dr. Danie, how are you doing?
Good morning. I'm doing well, thanks. Thank you for having me on.
Thank you for coming. Please teach me how to pronounce your surname. I've been trying. I don't want to murder it.
My surname is Breedt. It's very Afrikaans.
Breedt. Okay. That's very Afrikaans. I don't think I'll be able to. Dr. Danie, how are you doing? Please introduce yourself to our listeners.
Well, thank you for having me. So as you mentioned, I'm the Managing Director of Chorus Psychological Services. We're a group psychology practice that focus mostly on physical rehab and subacute settings. And that's how I spend most of my time is therapy within that context with people who've acquired new injuries. We also do training and supervision and workshops and talks like these. So that's how I enjoy spending my time.
So what led you into specializing in sexual rehabilitation for individuals with disabilities?
So firstly, I'm obviously passionate about this field just of physical rehab in general. And I think sexual rehabilitation, especially people with spinal cord injuries, is a very important subject. It's one of the most asked questions is after a spinal cord injury is will I be able to have sex again? And in that sense, I think it was just a normal pivot or a normal area to specialize in to make sure that we address the concerns of patients, not that it's all about me, but actually assisting patients in the things that's most important to them. So I think in that sense, it was more of a being pulled in this direction than me pushing against it and trying to specialize in something. It sort of found me more than I found it.
That is very interesting. Do you maybe have a family member or history of disability in the family? Because I know at times people will be like, no, it's because my uncle or my brother or a friend of mine next door had a disability, so I thought.
Yeah, so where it happened for Chorus specifically, or where Chorus originated, is I'm the co-founder of Chorus, and my partner had a tumor on her spinal cord, and she was also in physical rehab, and she found it very difficult emotionally, as anybody would initially. And she's a psychologist by trade, and we just saw the massive need in physical rehab in those initial stages for psychological support. So that's sort of where Chorus started. Her and I started it together, and that's where the passion came from.
Thank you so much. So diving into our topic for the day, why do you think conversations around sexuality post-spinal cord injury are essential? And what do you hope the listeners could take away from today's discussion?
So I think sexuality in general is important to have conversations about sexuality, not just specifically related to disabilities. I think it's a topic that's not discussed enough for various reasons. But specifically in terms of when it comes to disabilities, I think when it comes to sexuality, there are more similarities between able-bodied individuals and people with disabilities than differences. The disability part of it is like an obstacle to, or might be an obstacle that could hinder you from having a satisfying sex life. But our hope is that people don't see it as sort of only looking to the obstacle, but rather saying, what is this obstacle and then what can I do about it, as opposed to just getting stuck at the obstacle. That there are things to understand and things that we can do to overcome these obstacles. I think that's sort of my hope.
True, and also from someone with a disability takes away from the spontaneity of your sexual life. So I think this topic is very important for a lot of us today. Could you maybe please take us through the sexual roadmap, what it might look like for individuals after a spinal cord injury?
Sure. The sexual roadmap is sort of like a metaphor that I use when working with patients. And the idea there is if we say that our destination or goal with this process is to have a satisfying, intimate life. That's where we want to get to. And the sexual roadmap is then, what do we need to do? What is the path that we need to follow? How do we actually get there? So that includes discussions like understanding what just natural sexual anatomy is all about. Because understanding the anatomy, I can then take it to what is the impact that this injury or the spinal cord injury has on my sexual functioning, so you can sort of see where it fits in. And then, of course, the information just on what are the different interventions to address these different impacts of your spinal cord injury. How we get there, I sort of see as the vehicle on this roadmap. So there are certain things that we need to have as we are going along this route, and those include things like communication, being open-minded about alternative ways to look at sexuality, experiences, relationships, and so on. Experimenting with new ways of sexuality, and then of course access to information, just knowing, understanding your injury, but also what's out there. And sometimes along this route we need navigators, people who are on this journey with us. And in this analogy, for me, that's the professionals, the people who have that additional information, tells you, go this route or watch out for that, keep this in mind. So that's sort of just the metaphor that I use in terms of explaining sexuality, specifically as it relates to spinal cord injuries.
So I know that you wrote like an issue for Rolling Inspiration on sexuality after spinal cord injury, right? And there is a term that I'm not sure if I'm gonna be able to pronounce it. There's a term that I saw there, and I need you, baby, to break it down for us. Please explain what autonomic dysreflexia. Okay, that's
autonomic dysreflexia,
yes.
Autonomic hyperreflexia, which is the same thing. This is a fascinating ability of our body that that it just shows how intricate we are put together. But basically, what it is, the autonomic dysreflexia, usually you find with people who have injuries at the T6 level or above, so the higher injuries, sort of in the middle of your spine and a bit higher. What basically happens is, since a spinal cord injury affects everything below the level of injury to some extent, usually within sensation and movement, often things that happen under the level of injury, the body might not be directly aware of. So if there's a bladder infection, for example, or there's a bowel obstruction, or sometimes this happens when people have an ingrown toenail, or there's something that you're not aware of, something that's almost like wrong under the level of injury. And this is an indirect way for your body to warn you about that there's something going on. Because our normal the normal feedback loop, as in if I say I injure my leg and I can feel that, so my brain registers pain, so give attention to that, that normal feedback loop isn't working as it did before. So autonomic dysreflexia is then your body's way of warning you that something is going on under the level of injury. And how that presents is, it is a sudden spike in your blood pressure, and then things like sweating, headaches, nausea, sort of a visual, like a blurring, all of those things are sort of the warning signs. People experience it differently. They might feel differently for you, but those are sort of the typical symptoms that you see. And the reason for autonomic dysreflexia can vary in severity. So sometimes it is just, if you have an indwelling catheter, it could be that the catheter might be kinked, or it might be, like I said earlier, bladder infection. Sometimes it's like a cut, it could be an ingrown toenail, but it is sometimes also, that response is also triggered by sexual activity. So it is very individualized, and you sort of have to figure out how your body responds. But when you experience autonomic dysreflexia, it's a very important thing to pay attention to. To obviously then look for what the cause is, and if you can't find it, to actually go to the emergency room. This could be a life-threatening affliction, because if your blood pressure is prolonged for a long period of time, there can be other medical complications. So it's a very serious, it's serious symptoms to pay attention to. But usually when you address the cause of it, the symptoms go go down quite quickly after that. But it is just something to pay attention to, and I think it can cause some anxiety for people if they're engaging in sexual intercourse and their body responds in this way. But to know that could be a normal response to it and what causes it. So it's a bit of just playing Sherlock Holmes to see what's going on in your body under the level of injury.
So how does it impact intimacy?
So, I mean, they'd be different. Again, this is where it gets a bit individualized. So, if autonomic dysreflexia is triggered in some sexual act, or there's something that's happening while you are being intimate, it's important to then see what happens. It would be difficult to continue with sexual activity if you're feeling this intense, high blood pressure, could feel like a panic attack or a heart attack. It could feel very intense, and it's obviously very distracting from what you're actually busy with. So in that sense, it could have quite an impact, and I can imagine it's quite anxiety-provoking if it happens the first time. Being quite a shock, and and that just affects the whole mood. That it would be difficult to just sort of get back to the sexual activity and everything around that when you're worrying about what's going on in your body.
Thank you so much for that. I think that's valuable information, because there's various ways that our bodies communicate with us, but then we really do not know what it means. Yeah. And I think if someone had suffered a spinal cord injury, this is one of the symptoms that they would have, that okay, no, nigga, there's something wrong within your body, you need to get it checked out. Oh, okay, thank you so much for that. Lalela with Skills Village Radio, you're still tuned into the Health and Awareness Show with Princess Sibanda, and today we are discussing sexuality after spinal cord injury. If you do have questions for us, or if you do have questions for Dr. Danie, please do WhatsApp us on 073-941-0214. Or if you do just have any comment about today's topic, also you can reach out to us, and you can follow us on our social media platforms. It is Skills Village Radio Official on Facebook, Skills Village Radio on TikTok, Skills Village _radio on Instagram, and also on YouTube, where you can catch these episodes with Quad Para Association, the post-production episodes with the Quad Para Association of South Africa on YouTube. It is Skills Village Radio. Don't forget to subscribe and hit the bell icon. Dr. Danie, so just to continue our conversations, what changes can people experience with female arousal and male erection after spinal cord injury? To our listeners, please do not cancel me. This is a very interesting topic and very important topic to have. So there would be terms that we might use that might seem a little bit extreme. So do please forgive us for that. Yes. So what changes can people with spinal cord injury, female arousal and male erection, experience after spinal cord injury?
So yeah, I think it's easier maybe to start with the females. The males' hardware is a bit more complicated than females, so let's start with the females first. I mentioned earlier that with a spinal cord injury, the two things that are affected below the level of injury is movement and sensation or feeling. And that's the biggest impact for in terms of female sexuality is the physical sensation. So there might be diminished feeling, and that obviously can affect the experience of intercourse. And on a physiological level, a big or important thing that happens with female sexuality is that there might be a lack of natural vaginal lubrication. So in terms of an intervention on that part, is sort of straightforward, because any water-based lubricant can be helpful in that sense. So obviously it changes the experience of sexual intercourse and so on, but in terms of practicality and a solution, water-based lubrication assists there. And I just want to sort of emphasize the water part, not oil-based lubricants. Water-based lubrication helps or maybe rather say oil-based lubrication has a higher risk of infections and other complications. So water-based lubrications that you can find at any pharmacy and so on could assist with that. On the male side, it's a bit more complicated. As I say, males have external hardware in terms of the penis that is affected with the spinal cord injury. And an erection basically requires some sensation and some movement to be able to be generated. So for males, usually there's a difficulty in either being able to get an erection, or sometimes men can get an erection, but it's only a partial erection. And then the last question is how long can it be sustained? All of those questions sort of give you a sense of how usable is the erection that I can get naturally. And a big part of that is the completeness of the injury. So you'll often find people who have an incomplete injury, meaning that the spinal cord hasn't been severed completely. There might be some sensation or some movement that's still possible under the level of injury. And then you often get that males can have a partial erection, or they can have an erection but it doesn't stay for long. And all of those factors are important to take into account when you're talking about what are the interventions, what can we do, because there are a variety of ways that we can intervene. And I can maybe go into a few of those if you'd like, then I can just sort of chat about that.
Yes, please. We can.
All right. So there's a variety of interventions that we can look at for males, and all of them have their pros and cons. So I can maybe go through each of them and just sort of what are the upsides, the dangers, things to look out for. For thoroughness' sake, I'll go through all of them, but I want to just say a caveat here is that don't try any of these without consultation of a professional, because there could be some side effects and there could be things to be aware of. So it's important to actually have a professional advise on what would be most appropriate in your situation. But one of the solutions is penile implants, and you get a variety of those. The upside to it, the positive of that is that it will definitely work. You will definitely be able to get an erection because it's a physical implant. So you can't not get an erection with that. It works. But the downside to that is it's very invasive surgery. So you need to go to hospital, you need to be under anesthesia, and it's quite invasive. So the normal complications that can happen with surgery, all of those things need to be taken into account when making a decision on penile implants. So usually I don't recommend that. It's expensive, it's dangerous. It's once everything's done, if everything went well, sure that it works practically. But that's one that I think has sort of a high risk profile. The second one are penile injections. It's basically a medication that gets injected right into the penis. It tends to work quite well, but there's a few downsides to it. Firstly, even though some people might not have, people who has a spinal cord injury, especially the complete injuries, might not have sensation in the penis, so it's not painful to get the injection. It might be difficult to give yourself an injection, so often we need a doctor to give it to us. So you need to have an appointment with a doctor, which you need to pay for. You need to pay for the injection itself. And then from the doctor, you need to go home and sort of very much planned and busy, and now it's coming back. So there's a lot of pressure on this now. You need to.
So if you don't get lucky, it's a waste.
Yeah, then you pay. It's very expensive. The medication you can also not. You need to store it in a cool place. It needs to be in the fridge. It expires. It's quite a process. And the biggest downside to it is that it can cause a priapism. A priapism is an erection that doesn't come down, which is something that you may need to get another injection for. So you need to go into a hospital to get an injection to get it down. In that sense, it's not an intervention that I recommend. But again, that's more a medical doctor would be able to advise on that if it's appropriate for you. But just in terms of the cost and the risk profile, again, that's not something that I really recommend. The other two options is medication or creams. Basically, what medication does in terms of, so that's usually like a pill that you drink, is that it affects the blood flow. So with an erection, once there's arousal, there's blood that flows into the penis, and the arteries then close off while there's an erection to maintain the erection. And medication helps with that process. So it increases the blood flow. So for patients who can get a partial erection, that's often a possibility, so that you take that it increases the strength of the erection. So it helps with that. But very often people who can't get an erection at all say that the medication doesn't really have an effect. So there's a wide variety of options, and some are prescription, some are not. And so this is like with any medication, you need to be careful there. Again, to consult a doctor with those. And since it affects blood flow, very often this also has an effect on blood pressure, which is sometimes a difficulty for patients with spinal cord injuries. And so in that sense, there's a lot to take into account and to sort of account for. And sometimes there's some frustration that goes with that, in the sense that you might try one and it doesn't work, but it doesn't mean another one won't work. So now you have to pay again to try something else. And so you have to go through this process, and sometimes people find that a bit frustrating, which you can obviously understand. But that's quite a common method that people tend to try out. But there's just a few things to take into account, especially maybe having a conversation with the doctor. The last of the suggestions that I make is a vacuum device. The one that I always recommend is called a VacuRect pump. It's a South African pump. It's developed in South Africa, but it works wonderfully. The concept of it is that there's a silicone ring that gets placed around the base of the penis, which basically cuts off the blood flow like your arteries usually would. So you put that on first, and then there's a vacuum device that goes over the penis. It's sort of difficult to explain without being able to show you, but
Yeah.
there's a vacuum device you put over the penis. It looks like a big tube, and as you pump, it creates a vacuum. So it basically pulls the blood into the penis, which causes an erection. And the silicone ring at the base then keeps the blood in the penis. And then once you've had sex, then you take the silicone ring off, and then the blood drains out of the penis again. So in terms of practicality, the vacuum device is probably the most practical, because it will always work. It's not reliant on your bodily processes or anything like that. It's a practical solution. And you only pay once, or if you can use the device over and over. It's not like the medication that you have to buy every time. It's also much safer because it works mechanically. The only thing that's in terms of safety to keep in mind there is to not leave that ring on. Any area that's deprived of blood flow can get damaged. So once you're done having sex, it's just important to remember to take the ring off. But other than that, it's very safe, and it's very cost effective. So that is generally my recommendation with for erectile dysfunction, and not just people with spinal cord injuries, erectile dysfunction in general. So that's quite a mouthful, and there's a lot of information there, but the categories that I usually explain to them.
Yeah, no, I think the last two assistive devices are the best for anybody, because honestly, the first ones that you mentioned seem impractical. I know maybe they might work for other people, but then the last two, because you can just run to the pharmacy, get yourself, what do they call them? Those blue pills, Viagra or so. Yes, yes, and then also the pump. It's something that is practical, because you also don't need your doctor to help you with using the device. You can just use it yourself, or get your partner to do it for you.
Exactly.
Thank you so much for that, Dr. Benny. And we're quickly going to go on a short musical break. And when we get back, we'll continue with today's conversation. Lelo Skills Village Radio, you're still tuned into the Health and Wellness Show with Princess Siban. And today we have Dr. Danie, who is taking us through sexuality after spinal cord injury. And if you do have questions for him or for me, or any comment, you can reach out to us on our WhatsApp, which is 073-941-0214. We will see you guys shortly. Lelo Skills Village Radio, welcome back. You're still tuned into the Health and Wellness Show on Skills Village Radio. We are with Dr. Danie from the Corporate Association of South Africa, and the Managing Director of Caries. The first time I pronounced it as cherries. Is it caries or cherries?
It's Caries.
Caries. Is it? Oh, okay. Okay, thank you. So Dr. Danny, Skills Village Radio is celebrating our men this month, since November is Men's Health Awareness Month. So, do you maybe have, before we continue with our interview, do you have maybe a few words for our males with disabilities in terms, like something, words of encouragement when it comes to their mental health and just their health in general?
Well, I think there's a need for male figures in society. I think it's important that we stand up and that we teach the next generation of men that mental health is important. That we're willing to talk about it and willing to support each other in that. If that was like my one goal, my one message, I would really encourage men to be transparent about that, to open up conversations about mental health and just be advocates for men.
Thank you so much. Thank you, Ms. Wheeler. Just open up, speak up, do not burst. Start speaking while it's still early before everything piles up. Thank you so much for that, Dr. Danny. So moving on with our interview, I think this is my favorite question. And I think the listeners will understand why. Right? So positioning can be crucial for comfort and pleasure. Are there any techniques or resources that you could maybe recommend for those exploring new ways to be intimate?
Yeah, so I hope I didn't disappoint. I think the concept of the assistive devices and all of those falls a bit outside of my area of expertise. I think that the people who really have a lot of input there and a lot of creativity that I have immense respect for is the occupational therapists. Their creativity to customize certain things for individuals, I think, is unmatched. But I think the important thing to just note is that there are a lot of assistive devices, a lot of things like cushions and hoists and all sorts of straps and devices that can be attached to your hands if your hand function is impaired. But unfortunately, there's not a one size fits all. It would be something that would need to be customized for individuals. So my recommendation would be, if this is something that you're interested in or something that you want to sort of learn more about, is to reach out to an OT that specializes in spinal cord injuries, so they can match an assistive device that meets your specific needs and your specific requirements. I really have a lot of respect for them. As I say, my knowledge on it is very limited, but I think it's a very important part of just being able to have a satisfying sexual experience.
Did you say hoists?
Yes, they're
I believe some of us do have hoists, so I think that's something that could be explored.
Yeah, and I mean, you can be so creative with the equipment that you have. I mean, you've got a wheelchair to your, that you can use in various ways. We just need to think of the same equipment to use it in creative ways. So I think there's a lot that can be done there. It's all about, as I mentioned earlier, openness, thinking differently about what you have access to and what you can use in different ways. So there's no limit to the creativity that you can employ.
Thank you so much for that. I think you have sparked a few ideas. So if you are listening and you have a few devices that seem like they might work for you, just try it. Just don't break, but try it out. Okay, from your profile, it is mentioned that you work from an integrative interactional approach in psychotherapy. How does this approach support patients dealing with sexual rehabilitation after injury?
Yeah, so integrative interactional approach sounds very fancy, but the core of it is basically that it focuses mainly on communication and relationships. It sort of posits that effective communication and the quality of your relationships determine your level of emotional and psychological well-being. So when you think of sexuality and spinal cord injuries, intimate relationships, all of those things through this lens, everything comes down to relationships and how willing we are to communicate about those things. So if you think about communication with your partner, in that relationship, figuring these things out, communication is vital. You need to be able to talk about what your preferences are, what works, what doesn't work, how we're going to figure this out. All of those things come down to the communication that I'm willing to have in that relationship. Relationship with professionals, for example, if you don't open up that conversation with a professional about what you're struggling with and give some content to what they can assist with, their hands are really tied in terms of what they can do. But there's a wealth of knowledge out there that we tap into through communication. And I mean, even on a very basic level, the relationship that we have with ourselves. How do I think about myself? What is my self-image like? How do I think about myself as a sexual being? How do I communicate that to others? And in essence, a spinal cord injury is a breakdown in communication between your brain and a different part of your body. So how does that communication just internally affect how you function and so on? So that's sort of, I want to say, the core of the interactional approach, and how I bring that in, the psychological effects of that.
Oh, thank you so much for that. So, can you maybe tell us how psychological support can aid an individual's way of navigating? Sorry about that. I lost my train of thought. Can you discuss how psychological support can aid an individual in navigating changes after a spinal cord injury?
Yeah, so again, the experience of individuals after a spinal cord injury is very individualized. What you might find difficult might not be difficult for me, or what really gets to me might be different for you. So a big part of it is just navigating all the changes, both physically, socially, sexually, all of those changes that come along with the spinal cord injuries, just to sort of assist with that. I often find that there are many misconceptions socially about especially sexuality and spinal cord injuries. And this can often lead to ignorance and judgment and shame and even discrimination. And all of those things could have a psychological consequence. And I mean, the core of that is just a lack of knowledge from either people with spinal cord injuries that don't know how those things are, or from the general public. And I think it's important to educate and advocate about sexuality. So where psychology comes in is to help assist with those impacts, but also to empower people with spinal cord injuries to go and educate and advocate for, not only for spinal cord injuries in general, but also sexuality and opening up conversations about that.
Very interesting. Also, we know the brain plays a big part in our body functions and everything. Can you maybe tell us how it remains the ultimate sexual organ and what this means for people with spinal cord injuries?
Yeah, I'm so glad you bring this up. It's something that's really underrated when it comes to sex in general. It's just the importance of the brain. So easy to focus on the physical part of sex that we forget about the brain's effect on it. And you can often see this with even if we take spinal cord injuries off the table, and we say and males would be able to attest to that, this is that if you are feeling stressed or you're feeling distracted, if you're feeling depressed, you'll struggle with erections. In the same way for females, that you might experience low libido if you're going through a stressful time and so on. So there's a very powerful effect that our psychological state and where we're at in our mind have on our experience of sex. Paradoxically, when I'm engaging in a sexual activity and my thoughts are somewhere else, it affects the experience of that. I'm almost there in body but not there in mind. And to align those, I think, is important to having satisfying sexual encounters. And in the same way, orgasms happen both physically and in your mind. And something that a lot of people might not know is that it's possible to have an orgasm without physical sensation in your genitals. It's a new way of thinking about it, because you might be so used to experiencing it in a certain way that feels completely foreign to you, but those things can be taught. Just as you were taught how to interact on a sexual level, the being present and experiencing the moment, being in the moment and being mindful, all of those things contribute to a satisfying sexual experience. The physical part of sex is actually a very small part of of sex, but we often make it up to be such a big thing that we obsess about it and we ruminate about it, and then we ironically prevent ourselves from having a satisfying experience. And a big part of that is just shifting the focus back to how we think about it, just being in the moment. And I mean, I can go on about that topic for the whole day, but I think you get a sense of what I mean.
Yes, I do, and that is very important. Just being in the moment is very important when engaging sexually, and yes. So Naluri Skills Village Radio, we're still here, we're still talking to you. This is still the health, and I want to show. And again, if you have any questions for us, because if Dr. Danie leaves today, you might find difficulties reaching out to him. So I brought him here to you so that you can ask every question that you might have when it comes to sexuality as a person with a disability. So Dr. Danie, a lot of people face difficulties when it comes to forming relationships or relationship after getting an injury or as a person with a disability. So how do we address issues like my partner will leave me because I can't satisfy them sexually?
I think a big part of it is, and this comes back to the psychotherapeutic approach that I use, I think taking some pressure off the topic of sex by redefining it as just communication might be helpful. And what I mean with that is the physical act of sex is a way to communicate something, whether it is communicating love or intimacy or just the need for sex or whatever that act is communicating something. So if I start there, if I say that I want to communicate something through this, it takes pressure off the physical act. So if you, for instance, want to build a relationship, it's possible to do that. It's not now that I'm in a wheelchair or something that I can't still be in a satisfying relationship. It's about looking past that and saying what is it that I want in this relationship, what do I want to communicate, and we can communicate that despite physical limitations. What I've seen in practice is that it's very seldom that relationships end after a spinal cord injury of one of the two partners because of the physical limitations. It's much more frequently about the emotional disconnect that might happen afterwards. And it's so ironic because people get stuck in their own head assuming these things. So to say that I'm not the person that I was before, so how can my partner still be attracted to me or love me? And it's almost you get stuck in your own thoughts, and which makes you withdraw. And there's this emotional gap that starts forming between you and your partner. And at some point, it just feels like you're not on the same page anymore, and it slowly drifts, and then it might end over time. But the irony is that it's a preventable problem. That is a problem that you start in your own head and then sort of feed it by yourself. And by communicating about that and talking it through and so on, it can actually foster more intimacy to allow your partner to also support you in that and figure this out together, as opposed to saying, well, you've got this problem now, you need to figure it out. So it's ironic that we sometimes end up causing the problem that we're trying to avoid by not communicating about it.
Thank you so much for that. So moving to another big question that our listeners might have is, how does spinal cord injury impact fertility and reproductive health for men and women?
So there's a short answer and a slightly longer answer. The short answer is it doesn't. It doesn't affect fertility, but there's some nuance to it. So let's maybe start again with the women, because as in all aspects, women are much more easy to understand than men. For women, there's not an effect on fertility. Women can still get pregnant after they've had a spinal cord injury. Their menstrual cycle sometimes ceases for a few months directly after an injury, which is just because of the shock to the body. It's not because of the spinal cord injury specifically, but that usually returns within a few months. So it's not a permanent effect, but that's sort of the one area in terms of fertility that might be affected. For men, the semen production doesn't get affected, and also the fertility of sperm doesn't get affected by a spinal cord injury. The only area that does get affected in terms of fertility for males is the process of ejaculation. So, which means that for the semen to actually be ejaculated, that part is affected. But it's not the semen quality. It's the muscles that actually needs to transport the fluid out that is affected by the spinal cord injury. So it often happens that the ejaculate might be a little less in volume, but the semen that does come out is still fertile if there wasn't any fertility issues before. All of that is still the same afterwards. So I think that's just important to remember, that if you are trying to fall pregnant, it can still happen. And if you don't want to, it's important to still practice safe sex, whether it is the condom or other types of methods to prevent that. But like I said, the short answer doesn't affect fertility in that sense.
So, what considerations should individuals keep in mind if they are planning for a pregnancy after a spinal cord injury?
So this is another area that I think is you should definitely consult a specialist to make sure that the advice you give is specific to you. But I can give some broad guidelines, or maybe just some things to think about. The first, as I mentioned just now, is that it is still possible. So to keep that in mind, that even just by engaging in sex and like you would normally do, can still do it. That can be enough to actually fall pregnant. But if you do struggle to fall pregnant, there are alternative methods that a fertility specialist would be able to assist with, things like artificial insemination or in vitro fertilization, IVF. Those kinds of things can also be done, but that would need to be assessed and advised by a specialist. So I think that's just some things to keep in mind in terms of falling pregnant. In terms of the pregnancy itself, once you have fallen pregnant, it's important to have a specialist that walks the journey with you, that has an understanding of spinal cord injury specifically. I always say that the spinal cord injury affects the pregnancy, and the pregnancy affects the spinal cord injury. And you have to sort of monitor how that process goes. So you can still carry full term. Everything could be broadly the same, but it's just important to often you have more checkups regularly to check that everything's fine. Be aware of what you can and can't do. Things like being more aware of pressure sores developing because now you're physically heavier, for example. So all of those, just I also want to say practical things are things to keep in mind. They suggest a cesarean birth as opposed to a normal birth, a vaginal birth, because it just makes it practically a bit easier. Because the muscles are affected when giving birth, things like that. But as I say, all of those things I would sort of consult a specialist on to make sure that they walk that whole journey with you.
Thank you so much for that. The time is 11:14, and it will be 11:15 in a few seconds. I know. So I'm Mlaleli with Skills Village Radio. You're still tuned into the Health Now Show. Please do follow us on our social media platforms. It is Skills Village Radio everywhere, but Skills Village Radio Official on Facebook. Just to keep the conversation running, make sure that you interact with us on our social media platforms. Today we are covering a topic on sexuality after spinal cord injury. Hence I was excited about today's topic because we finally get an answer to how do you do it, because it's a question that a lot of persons with disabilities, especially physical disabilities, have when they meet someone who might not be informed about the lives of people with disabilities. So, Dr. Danie, I don't know if you are aware, as people with disabilities, once you have a disability, it's like there's this thing, or someone gives authority to people to just pay attention to everything that you are doing, right? They would pay attention to how you are about your dating life. They would want to know about your dating life, or they would be snooping around on how many partners you've been with, and so on and so forth. Like it's like they are fascinated by the life of a person with a disability, and sometimes it's uncomfortable because it seems like maybe, for lack of a better word, you have multiple sexual partners. Why? Because people are watching, right? Unlike someone who's able-bodied, who maybe might have 4 or 5 partners in 3 years, then they wouldn't pay much attention to that. But because persons with disabilities are somewhat not expected to have fulfilling relationships, so it then seems like you are doing it wrong. So could you maybe discuss some ways individuals could cultivate sexual wellness and maintain a positive sexual identity without feeling any shame?
Yeah, I think it's so important what you're mentioning. It's like it puts the spotlight on you. Now suddenly you are allowed to be assessed and put on display and so on. Whereas it might not be that different for somebody else. It's just because now that you have a disability, it almost gives people the right to put you under the magnifying glass. Yeah, I think I wish it was different because it shouldn't be different. I wish we could just say that it shouldn't be and then it is different. But I think you're right that there's a reality to what your experience is, and I think it's quite a common experience. My advice generally in the past when I've worked with a few people sort of expressing that concern or that difficulty is to steer into the skid. and what I mean with that is to when we put something under wraps and when we don't talk about it and when we sort of put it away, it builds the curiosity. So it almost has the opposite effect from what we actually want, is that people actually are now more curious. It feels like, why do we not talk about this? Is there something that I'm missing? And it almost builds the value of it to something that it's not supposed to be that big of a thing. So what we often work at is the inner work to sort of get comfortable with that first, to say that your disability isn't your identity. You can't see me now, but I'm quite a tall person, and my tallness doesn't make me who I am. In the same way that your disability doesn't make you who you are. It's part of who you are, just like my height or my ethnicity, my gender. All of those things contribute to who you are, but that one thing isn't all you are. So to sort of work with that a little bit, to say that, but who am I? Without just focusing on my disability, so my disability is not my identity. I think there's some personal work to do there that we can empower people to say, but I'm more than that. And when you sort of start feeling comfortable with that, you show up differently in relationships. We tend to think that people have a certain view of us, but it very often works the opposite direction, that people actually take their cue from us, meaning that if I'm comfortable with who I am and I'm willing to answer a question, willing to engage with it, initially people might have some questions and some comments and things about it, but when you're embracing it, it tends to move over quickly. People sort of ask what they want to, and now it's not a big thing anymore. So I often try to get to that, is that when I'm comfortable with myself, people tend to handle me in that way. They react to me in that way, and to sort of empower people with disabilities to allow people to ask questions and so on. I think it helps on various levels. On the one side, it brings some awareness to people with disabilities. It fights some of the misconceptions. It makes it not this thing that's sort of outside of the norm, but it actually truly integrates people. You get to look past the disability and see the things that unite us. When I started right in the beginning, I mentioned that there's way more things that we are similar in than what divides us. And I think it's helpful if we can assist other people to treat us in the same way. And I think that's sort of how you do it. That would be sort of my view on it.
Dr. Danie, if you can allow us, we're quickly going to go on a very short musical break, and then when we get back, we'll be doing the last segment of our interview. And again, thank you so much for joining us today. This is a very insightful conversation, and I think this is a conversation that we need to continue talking about. Like you said, if you take something and hide it and not talk about it, it then becomes a problem. But if we openly discuss it, just share some information about it, then it's no longer a taboo. So Mlaleli Skills Village Radio, please do stay with us. We'll be right back. And we'll be continuing with today's conversations. And don't forget to send through your comments or your questions, or you can continue the conversation on our social media platforms. See you guys right now.
Hi, I'm Richard Baron, General Manager of the Quad Paro Association of South Africa, also known as QASA, QASA. We empower people with physical disabilities, particularly those with spinal cord injuries, to live independent and fulfilled lives. Through advocacy, support services, and partnerships, we break down barriers and create opportunities nationwide. Join us every Tuesday at 10:30 a.m. on the Health and Wellness Show with Princess as we discuss important topics around accessibility and inclusion. For more info, visit qasa.co.za.